Great. Well, thank you, Andres. My congratulations to Team Michigan and a warm welcome to those of you from around the world, particularly from our colleagues in Africa. I'm so excited to be in this conversation with my friend and colleague, Minister Tedeschi. And if I was being proper, as we should always be with our colleagues, particularly in Africa, I would always be referring to her as Minister Tedeschi. But Leah, I hope I can call you by our friendship name, Leah, as I know you will call me Joe, because that's how we first became friends years ago back in Ethiopia. Leah, I wonder if we could start. I know there are a number of students who are listening in. You know, sometimes people hear our pedigrees that Andres just talked about, some of our mileposts. But often learners want to understand, what were we thinking when some of the decisions came up? So could you go back to your student days a little bit? What were you thinking? What were some of the drivers and decision points? You know, did you decide in high school you wanted to be the Minister of Health? I'm so inspired by your position right now. You're overseeing the health of a country with over 115 million people, with such a deep and storied culture. What decisions and what unfolded on your path that brought you to your position that kind of was recognized by some of those mileposts that Andres had referenced? Could you speak a little bit about that, please?
Thank you so much, Joe. So I will call you Joe.
Please.
And it's really truly a pleasure to be in this Africa Week panel and this fireside chat, especially with you, Joe, with all the long-standing relationship we have with the two institutions. And coming back to the question, it is definitely interesting to look back at all the decision points. And going back, I actually, as a child, I've always wanted to be a physician. Never thought of being a minister. But since I was I think a little child, I was always firm on my wanting to be a doctor, a physician. And fortunately, I went to medical school, and but I didn't have much of the idea of where my track would go, even in terms of specialty. It was when I was clinical year the first clinical year, or the fourth year of my medical school, when I started my rotations in the clinical attachments. My OBGYN rotation really had a big impact on me. I was trained in Jimma University, which is southwest, around 300 kilometers away from Addis. It serves a large population, catchment population, with, of course, access problems. So I was seeing many women coming with complications of labor or abortion or different maternal and gynecologic problems. And really, the intervention we did when it was saving lives, it was very gratifying. And of course, losing lives was also another side of it, which was very tough. But I was really emotionally attached to that attachment. So after that, I made the decision while I was in clinical, my first clinical rotation, to continue on women's health, maternal health, and similar. So after I graduated, of course, we, as in Ethiopia, we initially practiced as general practitioners before we joined a residency program. So after practicing 1 year of general practice, I joined residency in OBGYN in Addis Ababa University. And that was really, the 4 years of residency were also a year that it was a lot of learning, but also truly gratifying in terms of service as well. But it also, I was kept on being drawn into the system problems within the facilities I was working at. Although I was in one university, we did rotations in different hospitals, and the challenge of the patient care were also drawing me to be engaged in some of the improvement work. And after I finished my residency, of course, I went back to practice. I was working at that time at the Federal Police Force Hospital. But after maybe around a year after that, I had the opportunity to connect with the Minister of Health at the time, Dr. Tedros, whom you know very well, who's the current Director General of WHO, because of some presentation I did on our society. So that led to me to be offered to lead the St. Paul Hospital, who was at that time just in establishing a new medical school. It was just a hospital for many years, and then it was establishing a medical school. So it was a huge responsibility. I was just out of a year out of OBGYN residency with not so much leadership experience, but I had the passion. So I took the challenge and took the role of CEO of St. Paul, which was on the process of becoming a medical school. So I joined that process, which was a tough journey, but really a truly gratifying one as well in that process, which so in a few years, it became St. Paul Hospital Millennium Medical College, which is a full-fledged medical school. And that was another opportunity to also connect with a lot of partners. And it was I joined that in 2007, and the school launched in 2008. And 2 years later, we were still doing medical school, but we had the aspirations to also start residency programs. And that was when I had the opportunity to meet Professor Sanait Saha, whom you also well know, and she was a faculty at the University of Michigan at the time, and in the division of RAI. And she has been coming to Ethiopia to work with different institutions, mainly she was working with Addis Ababa University, but after that connection, because we also had the desire to also establish residency programs, and as a nation, we also had a problem of OBGYN. Maternal health was a big challenge. So that led to jointly establishing the residency program. So through that connection, the partnership with the University of Michigan, which grew, then that also led to my role at the University of Michigan. But that as a clinician, I always thought I would remain a clinician because it is truly something I loved doing. But I've always seen, especially in countries like ours, where we have so many challenges, unless we really work also on the health system improvements and make it better for those who are working on the clinical work, things won't improve. So that was why I was progressively drawn to more into the public health, the policy, the leadership role, and later landed in the ministry as a state minister and now the Minister of Health.
What a great journey. Thanks for sharing that. One of the lessons I heard there for the learners on this discussion is that most of us have got to our places not because we sought it as a destination, but we kept exposing ourselves to new opportunities. And what I heard from your discussion is bumping into people who open new doors for us. So I think we could both always encourage our learners, keep exposing yourself to being disrupted. You're never going to plan out your course in full, but take a step into the unknown and make things happen. Like Leah has, who has just had a wonderful journey, wonderful preparation. And I want to start to steer the conversation a bit, Leah, into educational models. But before I do, I wonder if I could just pick up on a tension that you referred to. You started out like me with a passion to take care of people. And then individuals, and then as you were doing so, you thought you saw, boy, the system isn't very good. And you got restless about taking care of the system, fixing the system and doing population health, which, thank goodness we've got our colleagues in public health and in other places that think much better about that than those of us who are physicians. But that tension where you had to leave taking care of the individual to suddenly think about taking care of populations and thinking about systems. How have you navigated that? How have you dealt with that, kind of starting off with one passion, and then I imagine you're so busy right now, you don't have that luxury of taking care of an individual because you're focusing on 115 million people. Could you speak to that a little bit?
Yeah, yeah, definitely. It has, especially in the beginning, it was challenging for me because, as you know, as a clinician, when you take care of patients, you see the results quickly, and especially in OBGYN, I think we see it much quicker than you do in internal medicine. But so that was really what makes it also more gratifying. But when you are working in leadership roles, health system improvement, the change takes time to see. So really that was one of the missing the role of clinical work by itself is one thing, but also that challenge of this requires time, requires patience but eventually you see the change, and eventually those changes have bigger impact for many people. So I think that's what eventually seeing those results making an impact, it really became more gratifying, and now I can think of what can I do more on that regard. So it has definitely it was challenging, and still I sometimes still miss it, but I also see my role can bring bigger impact.
Well, I know I speak for many when I say thank you for making that transition. I know you're making a big difference in your current role. As we start to think about education, you have such a unique perch. You're looking over a system. You're thinking about society as, in the public good. Sometimes those of us in education can be accused of just living in the ivory tower. We're just doing our ivory tower polishing, where we're writing our papers, doing our education, but often we could be criticized for not connecting education to the good of society. So you spent so much time in education. Now you're dealing with the good of society. I wonder if you could say a bit about education models that you see that you've seen work, that you've been particularly attracted to. And obviously you're a citizen of two worlds. We were lucky to have you with us here in Ann Arbor for a number of years, deeply embedded in our system. You came from Ethiopia, you went back to Ethiopia. So you know two worlds. Could you talk about education systems that, and maybe some reflections on that connectivity between Michigan and Ethiopia, and how we can better design education for the good of society?
Thank you, Joe. Overall, I think when we see the education system and the bigger system, the society, the impact of the academic systems cannot be really separately taken from the overall growth or development in any society. I may be focused more on the health sector because I'm in the health sector in terms of also the education. My examples may be more inclined to that, but definitely the education, what we produce in the education system is what eventually influences how we develop as a society, as countries, as nations. And in terms of models, especially in terms of, since you mentioned especially how the models of partnership work and what I have seen, there has been different experiences of different types of partnerships that I have had the chance to experience in terms of in my different roles throughout, but especially in academic partnerships, we've seen some are specifically driven by specific projects that may be time bounded, so and also specific tailor-made, and some are really built, evolve continuously, and are built by mutual partnerships of both institutions in countries, and mostly since we are talking about also North and South partnerships and collaborations, so I had those different opportunities, and even there are also have been instances like where universities in the US and other countries have been engaged in establishing vertical programs in countries when we had the need for that, like the when HIV programs were introduced in many African countries. They were mostly led or supported by universities in the North, which had its own really huge advantage, but also had its own challenge in the way the vertical programs were designed in terms of sustainability. But I definitely would like to highlight how our partnership with the University of Michigan, especially which started at St. Paul for us, had evolved, and really the strong results and successes of that partnership. And of course, we will all have challenges, but I would say from the different partnership, it has been one of really the strong partnership models. It initially began with really solving the problem at the priority problem in the host country. So usually, I think many years back, we have seen a lot of partnerships globally where it's usually focused on getting experience for students, and mainly that is a focus, although all partnerships still have that, need to have that core pillar, but this was one of that aspects of the partnership. It mainly focused on what is the key challenge that we have in the system and how can that partnership help in solving that problem. So developing training programs through the partnership was the big priority we agreed upon, and we co-designed the curriculum that's needed for opening those residency training programs. And then also it was not just run by, because these were new programs, we didn't have enough faculty, but that didn't even mean that it was run by University of Michigan faculty. It was actually run by the local faculty, but was supported by, strongly supported by University of Michigan faculty who are coming with students, and also our faculty were going to get that experience sharing as well to Michigan. And this also really was not just focused on having just a residency program, but it made sure the quality of training was competency-based. It also made sure it included service quality improvements as part of the core aspect of the partnership. So it just didn't focus only on the academic piece, but also the service that is being provided to the community as well. And it embedded also research in the partnership. It was really a core component which helped in two main ways. One is in developing research capacity of the local faculty, but also in generating evidence that can help in improving services again, getting more local evidences for improvement. So the sustainable model of those programs, which eventually were fully run by the faculty locally, is really a true key aspect of the model that I have seen work very well in terms of especially the sustainable building capability sustainably. So it was a holistic, I can say it was a holistic approach, but also anchored on sustainability.
Well, thank you. And it's been really a privilege for us to share that journey with you and your colleagues in Ethiopia. And again, we're talking about education, so I'm glad you talked about training. And Obviously this fireside chat is a little bit more connected to health, but we're very mindful that health is only one component or dimension of Africa Week, this discussion. But I reflect on some of our past models of training and education and global health. I think many of us in the United States are mindful about 25% of the doctors in the United States come from outside of the United States. And I'm very aware that's a space I spent a lot of time in. It became very clear to me that we often attract people to come here because of our education systems. But unfortunately, we then train people not to fit in back home. I think most people, when they go someplace, they often think they're going there for a little bit, and then they're going to go back home. But because of our education system here, people, have to train for 3, 4, 5 years. By that time, they've learned skills that are appropriate to our system. It's a context that they've been trained for, but it doesn't necessarily translate for them back home. So unfortunately, those of us in the United States have been very guilty of creating brain drain, attracting people here, training them not to fit in back home, and here they stay. What we so enjoyed about partnering with Ethiopia was the chance to train people in Ethiopia within that context, and for us to learn and be part of that and be transformed by that process. But I'm so, again, inspired by your journey. You were trained there, then spent time in the United States, then you went back. Were there things about your time at the University of Michigan or things about your time in Ann Arbor that you think particularly prepared you to be health minister? Were there things that advantaged you and really set you up to succeed in your current role? Looking back, are there things that you learned while you were here at University of Michigan that are helping you out now?
Yes, definitely. I mean, every step of my journey has had its own contributions in the 3 years at the University of Michigan, which really gave me the opportunity to connect with different schools within the university and different partners of the university. So, and also look into the system of how the education system has been working at the university, and the collaborations we've had was not limited to where the Center for International Reproductive Health Training was seated on. It was not limited. I had had the opportunity to work with different parts of the medical school, the School of Public Health, and other members of the university as in the university as a whole, and even beyond that also with different partnerships through the university. And the experience and the learnings of especially the models of training and also the different leadership models and programs that were in place were quite a learning for me. That really also helped us. Also, while I was there, the work that we were doing was expanding in the work in Ethiopia, but also we had the work started in Rwanda as well. So all those opportunities had their own impact on has helped me definitely in the progress. And it was truly a learning opportunity for me, and an opportunity to also form really amazing relationships. And I've learned from many members of the faculty at the University of Michigan, and including you, Joe. Thank you so much.
Thank you, Leah. I can assure you I've gotten much more from our relationship and from what I've learned in my times in Ethiopia than I've been able to contribute. So thank you. For our audience, I will try and do my best to weave in any questions that people have. If people would like to use the question box, and I will try and add those in as they come up. Leah, we're talking, as we talk about education, maybe reflecting on the Michigan-Ethiopia interface, an area that has come up for us in global health is this whole concept of decolonizing global health. I have to say we're probably a little bit behind other disciplines. I think the field of education and of course anthropology and other areas have been talking about this for decades. I think you touched on this a little bit in some of your earlier comments. We've really been imposing agendas often on the African continent. You touched on HIV and AIDS, and suddenly the United States came up with $30 billion through their PEPFAR, the President's Emergency Program for AIDS Relief, into Africa, but it was driven by a very specific agenda. And unfortunately, if we look back on a lot of the research funding that comes onto the continent, it can also often be driven by an agenda in the global north. That's where the money comes from. So we're way behind in the global health movement in trying to think about how do we decolonize our approach and our thinking. Can you offer us any advice on trying to decolonize global health? Obviously the infusion of some money and some talent has been good, but suddenly dominating the agenda and driving a specific worldview is colonization again. And so I know the global health community nationally, but many of us are trying to wrestle with this. Any advice, any observations?
Yes, definitely the growth in the interest in global health and partnerships, especially academic partnerships, so in the past few decades has been really truly helpful in many ways for all countries in terms of academic development, and grows in the area of different disciplines. And the way it was, as you said, the way the colonization kind of approach has progressively definitely improved to make it more a mutual programs. But as you said, there are still rooms for improvement in our approach these days as well. Most programs, I think, as I mentioned earlier, are focusing on the local problems and how to address a local context, but also the solutions have to be also mutually driven, mutually designed, because it's not just addressing the local problem, but how we address the problem should also not be just, as you said, imposed. And even in research, as you said, most research areas, interest areas would come, but it should be designed together in terms of starting from the question we want to answer in the research, and then what we want to solve through the research, of course, needs that approach. And there are, of course, many motivation factors for all players in global health. Many motivation, most of them are really very good, well meant, but we always have to focus on the impact it brings to improve the gaps that we have, especially the equity gaps that we have, and how can ultimately this partnership bring us closer and bring those countries to really a sustainable, the road to sustainable development. It should ultimately bring that result, be it through academia, be it through health programs and others. I think that is one key, it should be one key motivating factor. Mutual one, it should have the benefit, should be for both sides, but it should have a local context, local problem solving, and also with a passion, really, with a commitment to bring some change in terms of the progress of in those defined disciplines. We are talking about all disciplines, not just health, but that's why I'm usually pulled to that. But definitely in all aspects of development, be it education, health, and other sectors. So I think that's the main core principles. I think if those motivating factors are there, and ultimately we should think of ownership to be by the local institutions. Otherwise, the sustainability usually goes back, and that's not what we want. If we invest that much of our time and resources, then it should show meaningful progress and sustainable one. So ownership also has to be also, I think, given to the local institutions.
Yeah, I think that was very well said. I so like our discussion that it's mainly focused on health, not healthcare, health. We know that the social determinants of health cross so many different disciplines. I think all the disciplines at the University of Michigan and at Addis Ababa University and the great schools of higher education in Ethiopia. So there's so many determinants of health, and that's really what we're talking about. You've talked about sustainability. I think it's such a crucial word. What's the win-win for both sides? A lot of times higher education in the United States have looked at places in the global South as a place for their learners. We're gonna ship off our students. That's the win for us. We provide them with a learning opportunity. I think what we've been trying to do, at least in our relationships with Ethiopia, and this exists with many of our schools, is stay very mindful of the win-win. I think sustainability requires a win-win. At least from my perch, I see a lot of do-gooders running into a place, but if they don't create the sustainability model on our side, it's not going to continue. There's a good heart there, but it's not going to continue. Yet, if it's just one-sided, we're getting a benefit from sending off our students, or our researchers can get access to data. That's very colonial, and that's not win-win. So I do believe there's an art and science to collaboration and how we design and think about that. I wonder if we could spend the last 5 minutes trying to dream about the future. Here I'm going to try and weave in some of the questions that we've seen, but I wonder if we could dream about what the University of Michigan Ethiopia collaboration looks like in 2040. What's that New York Times article read like? What have we accomplished? What have we done together? What's the win-win? What are we building towards? Can you think of some elements that you're hoping are just vibrant and alive in the University of Michigan Ethiopia collaboration in 2040? And I'll do the same because we're both going to be mindful of our win side. But can we just dream and see what that looks like? Would you like to start, or is it easier for me to start?
You can start, Joe.
All right. Yes, I can be fuller of hot air, as you know, through our long years of friendship, but I would love a platform that's so porous that people are going back and forth between Ethiopia and the University of Michigan, physically, but also making use of these things we're learning through Zoom, where we can have a much deeper appreciation of the context, the culture, and the people. I would love that kind of exposure for our students so that they can have their assumptions disrupted. You know, we always have a vision of something far away. We develop our assumptions, but whenever we get there, our assumptions are disrupted. So that people could have their assumptions totally disrupted and have a deep understanding of what is the situation in Ethiopia. What are the richness and the appreciation of the culture, but what's the problems? And what are the problem-solving opportunities? And to have that same way for people from Ethiopia to embed themselves in our culture without having to be totally transformed. They can kind of go back and forth like you have and bring some of the good parts back over the net and maybe keep going back and forth. And that is such an enabled process that people feel transformed, and the University of Michigan continues to be a better place because of what they've learned from the partnership in Ethiopia, and that maybe Ethiopia is better, and people are what they've learned from the partnership with Michigan, and that maybe we're the partner of choice when people are saying, I want to do research, I want to study, I want to make things better, and that we just have this easy platform that's that is just very enabled, that builds on UMaps and some of the other programs that we have underway, but it's transforming our institution. And if we could reach that state with Ethiopia, I think we would be so privileged. But that's my dream. That's what I'd like to see the New York Times article writing about. But thoughts or reactions?
Well, that's beautiful, Joe. You have finished what I would like also to see. It's beautiful. And before I just say that, what I would like to see, just to reflect a little bit on what you said earlier on how, well, to get to 2040, we need to have really a sustainable partnership model. And I think one of the key elements we always have in partnerships is a soft element, the people element, which strong relationships are always there. Strong, those who are committed to push those partnerships are there to help it flourish. But also that needs to be supported through a system in both ends to make it sustainable. I think that's one thing we may do better to reach to where we want to go. I remember when I was in Michigan, we always have been trying to track who is doing what in the different disciplines in Ethiopia, because even within the University of Michigan, there were many faculty doing work in Ethiopia, but didn't know that each other. But there was no strong. There was an attempt through the provost office now that Valerie leads to have the AMC initiative, but that kind of really having a system in place to coordinate all those activities so that it doesn't depend on people's motivation, because there is always a driving force behind to ensure that continues. But that needs to be there also here in Ethiopia, in the different institutions, at ministry level, at different levels, so that this continues, because we need to really continue to build on what we have started, which is really, I feel like this is one of the model partnerships that has been built for Ethiopia, and it needs to continue. And we have seen a lot of training programs being established, and even big healthcare programs like kidney transplant that were established through this partnership in Ethiopia. So I do hope in 2040, those partnerships will continue to flourish, and even having a strong program already in place that is led by the local institution doesn't mean that it doesn't need the partnership anymore. It still continues to improve it. The research aspect is there. Still, we are continuously improving, let alone in Ethiopia, you are continuously improving at the University of the Carey Hub at Michigan. So that continues, and we want to see several, because we have a vision now to really expand a lot of things in Ethiopia. So with the partnership, I want to see this amount of training programs opened and really full-fledged capacity created, and this kind of evidence is generated that have helped bring solution to the local community, but also have brought a lot of impact also in Michigan. So hopefully that's the future we will see, and I'm sure we will be able to see that with the strong commitment and passion, and with the different institutes within the University of Michigan as well.
Well, thank you. And I know we're at time. Minister Tedesse, it's been so good to have this conversation. Thank you for your friendship. And I know Ethiopia and the University of Michigan are going to continue to grow together and be better off for it. I'm going to turn this back over to our moderators for the wrap up. So thank you again.
Thank you.
Thank you very much, Dr. Kolarz and Minister Tedesse, for this engaging discussion. I really like how much of it has focused on exchanges between Ethiopia and the US, and that sets us up perfectly for the next part of Africa Week. So our next panel, which begins at 9:30 Eastern Time, so in 7 minutes, is focused on exchange programs between Africa and the United States and the role that it plays in this ecosystem that has been the theme of all of Africa Week. So thank you, Joe and Leah. Thank you for everybody who joined us for this conversation. Please stay online. We will use this exact same Zoom webinar link also for the panel discussion starting in 6 or 7 minutes. Thank you.